Hello, my name is Alexandra Santos and I'm a professor of pediatric allergy at King's College London and a consultant in pediatric allergy at the Evelina London Children's Hospital. Over the past couple of years, I've had the pleasure to chair the new EAACI guidelines on IgE-mediated food allergy, which included a module on diagnosis and another one on management. And I'm delighted to share with you today and highlight in this short video the new publication in Allergy of the management guidelines on IgE-mediated food allergy. This document was the result of multiple discussions between members of an expert group, and their names are listed here in the authors list. So what is the evidence that informed the new EAACI guidelines on the management of IgE-mediated food allergy? So we based our recommendations on a systematic review of the literature and meta-analysis that we did purposefully for the guidelines, and which covered studies on allergen-specific immunotherapy and biologics to treat IgE-mediated food allergy. We also allowed for key publications that came out since the completion of the systematic literature review to influence our decision-making when preparing the recommendations. And these were mainly studies of allergen-specific immunotherapy, on the efficacy of allergen-specific immunotherapy to peanut in preschool children, and also the publication of the first stage of the OUTMATCH study assessing the efficacy of omalizumab as monotherapy for food allergy, which formed the basis for licensing of omalizumab for this indication in the US. So what are the recommendations for best practice on the management of IgE-mediated food allergy? Well, these include dietary management, psychological support, an emergency treatment plan, and immunomodulatory treatments. Dietary management includes allergen avoidance and continued consumption of safe foods. An individualized dietary advice and dietary plan is ideal with the support of a dietitian if this is available, especially for the most complex cases. A novel aspect that has been included in these guidelines is the psychological support, which may be indicated for some food allergic patients for whom we should consider coping strategies or even cognitive behavioral therapy with the support of a clinical psychologist if this is available. It is essential to prescribe emergency medications to food allergic patients and to issue them with a written treatment plan with emergency contacts. And emergency medications can include an oral antihistamine, adrenaline autoinjectors, and inhaled salbutamol, depending on the patient. Patients who are prescribed an adrenaline autoinjector should be trained on how to use it. And what are the indications for prescription of an adrenaline autoinjector in food allergic patients? According to the EAACI anaphylaxis guidelines, absolute indications for the prescription of adrenaline autoinjectors in food allergic patients are a previous episode of food-induced anaphylaxis, coexisting unstable or moderate to severe persistent asthma, and underlying systemic mastocytosis. Relative indications are allergic reactions to foods known to be associated with anaphylaxis, allergic reactions to trace amounts of the foods, teenager or young adult age groups, remote location from medical help or prolonged travel abroad, and patients on allergen-specific immunotherapy. In terms of immunomodulatory treatments, the EAACI guidelines suggest omalizumab for the treatment of IgE-mediated food allergy. Peanut oral immunotherapy is recommended for the treatment of peanut allergy, whereas sublingual immunotherapy and epicutaneous immunotherapy are only suggested for the treatment of peanut allergy, mainly due to limited availability. Oral immunotherapy are suggested for the treatment of egg and cow's milk allergies, particularly after the age of 4 years, but not exclusively. That depends on the patient's and clinician's discretion. So for more details, please download the manuscript, which is available free of charge with an open access license, and you can have access through this QR code. And feel free to reach out if you have any questions or comments. Thank you.